Good afternoon, everyone. Today's presentation will be led by myself, Kyle Nutt, Tyra Roberts, Joshua Codrington, and Dhanya. And we'll be presenting the assessment and differentiation for Maria Boatswain. On today's agenda, we'll be starting off with a brief description of the case study. Then we'll move on to details of Maria's math problems, select an assessment instrument, give a rationale for choosing the KeyMath-3 assessment that was chosen. You'll see a video on how to use the KeyMath-3 assessment. Then we'll move on to post-assessment recommendations and program designs for Maria. You'll go over why these strategies benefit Maria and we'll close off with a brief summary. About Maria, she's a 7-year-old female in the Infant 2 classroom. She has Autism Spectrum Disorder, or ASD for short. The main difficulties are in maths, specifically number recognition, sequencing, and she has problems with addition and subtraction. The strengths, she enjoys hands-on activities, and she's a visual learner. Maria's current math performance, she struggles to identify numbers beyond 20. She cannot regroup in addition and subtraction. She has limited understanding of quantity and magnitude, and she shows low confidence during math activities.
Maria's diagnostic assessment, we chose to use the KeyMath-3 Diagnostic Assessment, or the KeyMath-3 DA. It is a standardized, individually administered math assessment that identifies specific strengths and weaknesses in mathematical concepts. We chose this instrument because it is comprehensive coverage of math skills, suitable for students with learning disabilities, provides known reference and criteria reference results, identifies precise skill gaps for targeted intervention, and allows monitoring of progress over time. Now we will just show you a video on how to use the KeyMath-3.
Hello, my name is Connie Davis. I'm here to present for you the test presentation, KeyMath-3. Connie Davis for Dr. Casey McPherson, Special Education Assessments Class 564. This is the KeyMath-3 Diagnostic Assessment. It's Form A, C.1 by Austin J. Connolly. Pearson Education Incorporated is the publisher. This is a comprehensive norm-referenced measure of essential mathematical concepts and skills. It's used to measure math proficiency, student progress, and to support instructional development and educational placement of individuals in grades pre-K or pre-kinder through 12th grade. The test itself, the components of it, it's made up of a manual, a testing manual, 2 testing easels, and there are forms, Form A and Form B, to record the scores. And then there's also the computer scoring and reporting software, which is called Assist. This test has 3 basic content areas. There is the basic operations, which is numeration, algebra, geometry, measurement, data analysis, and probability. There's also operations, which is the mental computation and estimation, addition and subtraction, multiplication and division. And then there's applications, which is the foundations of problem solving, applied problem solving. In describing the norm sampling, this consisted of, when they did the norming, it consisted of U.S. residents ages 4 years, 6 months through 21 years, 11 months, who were proficient in English. The author's goal when doing the norming was to provide equal representation of the demographic groups that reflect the U.S. population in race, sex, parents' educational level, and geographic region. And then this slide is continuing to discuss the norm sampling. The demographics were based on a current population survey from the U.S. Census Bureau from 2004. This is an age norm sampling, 17 groups of 220 individuals per group. And then the grade norm sampling that they did both age and grade norming. Grade norming was kindergarten through 12th grade with 26 groups of 110 individuals at each grade level. Then you have the basal rules that are included or incorporated into this test. When scoring, you're going to look for 3 consecutive correct responses before an incorrect response. That's the basal set. And then you will look at the lowest numbered item in the basal set, and that is the basal item. So it consists of basal sets and basal items. The ceiling rules are 4 consecutive incorrect responses, and the highest numbered item in the ceiling set is the ceiling item. So you've got ceiling sets and ceiling items. Those are the rules for the ceilings. And then when talking about the strengths of the test, I found that it is good for those who wish to evaluate the level of math that a young individual has, as it finds detailed information on basic skill levels. So it's just good for finding the basic skills. It's also helpful for developing a plan for instruction in all areas of math. The content is aligned to the current national mathematic curriculum and standards, and it is user-friendly. The weaknesses of the tests are that, well, all norm reference tests tend to be a little difficult to interpret, especially for parents and some teachers. Some of those Day 9 scores and percentile ranks are difficult. Students with limited hearing, vision, and English proficiency are not able to take this test, and students in other countries that have diverse educational and cultural backgrounds in mathematics may find this test to be inappropriate. When talking about validity, I just kind of included a little definition here of validity. What is test validity? The degree to which a test accurately measures what it's meant to measure. And so this test measured the various subtests within the test and found positive correlations at a 0.60 and above, which is considered strong. It also strongly correlated with other tests, and those are other math tests, of course, the KeyMath-3 the RNU and the KTEA2 and the ITBS, the MAP, and the GMADE. So these are all tests that it correlated with strongly. Then when discussing reliability, I included a little definition of reliability, the degree to which a test is consistent in measuring what it is supposed to measure. They took fall and spring test samplings, and the general findings of the total administration of both of those tests is that it is very high. 90s at grades 1 through 12, 80s and 90s in kinder, 80s at 4 years 6 months through 4 years 11 months. Other useful information about this test. This test is really helpful in identifying weaknesses in students that have learning problems. It can identify where the student's strengths are and where their weaknesses begin. It can help develop a plan for the student's math education. And it tells us where and how to begin teaching the students and broaden their math abilities. So for example, a student or students who view math as a simple set of rules and do not apply their knowledge to the real world, this test helps identify where to begin building their skills and how to help make a plan for developing experiences that will integrate with their knowledge into everyday life. So it's basically taking their basic skills and building them up to use them in everyday situations. This is the whole of my presentation, and I hope you found it useful. Thank you very much. This is Connie Davis. Bye-bye.
Okay, so some post-assessment recommendations. We'll implement an individualized math intervention program, focus on functional number sense and place value, include daily structured practice using manipulators, integrate visual support and task breakdowns. For program design, we will have 30-minute math intervention sessions 4 times a week, explicit instruction in number sense and operations. We'll use of concrete representational abstract or CRA model, and we'll have regular program progress monitoring using skill-based checklists. Some differentiated and high impact strategies you will use is manipulators such as counters, beasts, and blocks to build conceptual understanding. We will have some math centers with level tasks, visual support such as charts, number lines, and pictorial models, peer-assisted learning to build confidence and engagement, and frequent feedback and small step instructions.
So, with the instructions we decided that Maria can benefit as her strengths include that of visual as well as hands-on. We can see through repetition and modeling, she'll go on to support her memory as well as her recall with structured steps. We hope that we reduce her cognitive overload as well as her anxiety. And lastly, as we promote mastery of the foundational concepts, we would see an improved engagement as well as confidence with Maria. So to conclude, Maria has exhibited significant math difficulties associated with her disability, being that of ASD, right? And if you missed it, the assessment we decided to choose is that of the KeyMath-3 Diagnostic Assessment. And this assessment goes on to provide a comprehensive assessment of her needs. With the data received, we went on to create data-driven interventions as well as differentiation that is essential for her progress. So now here's a look at our references we used. Some more here. And we just like to thank you for paying attention to our presentation.